Hello, good morning, good afternoon, good evening, wherever you may find yourself. My name is René Najera. I am the Director of Public Health for the College of Physicians of Philadelphia, and welcome to another Public Health Chat. Today with me is Raquel Carnero. She holds a degree in pharmacy from the University of Salamanca and a diploma in public health. She did her education with a master's degree in the pharmaceutical industry in Spain. Her professional career spans roles in the pharmaceutical industry and consultancy in the regulation of medicines, health products, and health economics. She currently works in international regulatory intelligence, is a teacher, and actively collaborates with NGOs Pharmamundi in Spain. She is a co-author with Luis Marcos of Vaccinating, 2 Centuries and Counting, or Vacunando, 2 Años y Sumando. This is the Spanish title of the book, as well as Antibiotics versus Bacteria from Resistance to Counterattack Antibióticos contra Bacterias. You can see the books there in the background. You can find these books wherever you buy books as well. Raquel, thank you so much for being here with me today. It is a pleasure to have you.
It's a pleasure. Thank you for inviting me.
Absolutely. So a few years ago, I came across your book, Vacunando, Vaccinating 2 Centuries and Counting, Vacunando 2 Años y Sumando. It was fantastic. I bought it for my little girl. She, at the time, did not read, but now that she is reading, she is into it and practicing her Spanish as well. I want to ask you, number one, what was the inspiration for the book?
Well, we get this book together with the cartoonist, the illustrator, Anzola. He is a famous illustrator here in Spain, collaborates with newspapers. And we had the idea, the three of us. The other is another pharmacist, Luis Marcos. And we were bringing up the idea of bridging the gap. You know, there is a gap between what people talk and what's the common thought around science and about vaccines and what's the real science behind. And we wanted to make it accessible. So science outreach was our goal. And this book was first illustrated and created. All the bacteria, viruses have their own personality. And then we developed the book and an exhibition that is traveling around the country.
And what age groups are you focusing on for the book?
Well, it was not exactly aimed at children, you know, very small toddlers. No, it was more about 12-year-old and onwards. And we discovered that the way of the illustration shows bacteria and viruses, you know, this is a collaborative proposal. We talked to medicine, pediatricians, we talked to other pharmacists and teachers at school. And we know that you cannot scare people, you need to attract them to the message. So that was the idea. The illustrator gathers all these, encompasses the part of science, very rigorous science, because the message is really strict. We don't want to create misinterpretations with this topic. But on the other hand, it's very humoristic, you know, has a little trick of humor, and it makes it very, very attractive.
It is very enjoyable. I highly recommend that if you can read in Spanish, you buy the book and you take a look at it. And now you have the game. Can you tell us a little bit about the game?
Yes, we have the game, the playing cards. You know, this is our fight. We want to be there whenever there is somebody, you know, talking about vaccines and say, hey, let's produce one. Let's get the 5 steps from marketing authorization to manufacturing and placing on the market. So that's why we created this game that is very fun to play with. And you can also learn what's attenuate, what's inactivate, what's RNA vaccines, and all of that in a very funny way. It's based on the illustrations from Vacunando. Here it is, chickenpox.
Yeah.
You know, all the types of vaccines here. Let's not forget that we are based in Europe, and all the vaccines here are the ones that are in the national healthcare system calendar. So the people are very used to them. Is the way they are presented, you know, the combined hexavalent or the trivalent for chickenpox and measles and rubella. So, you know, that's the lightest one, the card for COVID. And well, that's the way we thought it was good. Get together, sit at a table and play cards. Why not?
Yeah, and in the United States, we just had Thanksgiving, and so this would have been great to have a conversation. And let me ask you, we know in the United States that we have a situation with vaccine misinformation and disinformation. A lot of it is just out there. There is a presidential candidate who is also spreading a lot of anti-vaccine pseudoscience and really not even science. How are things in Europe?
We don't mix politics with science. That's part of our culture. So the way here people interact with anti-vaccine or anti-vax groups, it's more in the social media and in circles where you talk to friends, but it's never on political agenda, because we tend to separate those It's not the current thinking that you should be voting this or that candidate and then adapt all their mindset. In Europe also we have a very strong healthcare system, national basket in which all the vaccines are included. In Spain we have one of the most comprehensive vaccine calendars in Europe. So now we've just added rotarix, so we have rotavirus, and we also have papilloma virus for both girls and boys. It's not a matter of accessing vaccines, it's more the way some parents go organic and then you start doubting about old-fashioned way of preventing illnesses. And it's totally wrong. They want to go beyond and they get lost. They get lost in Google, they get lost in chit and chat that allows them to think that they are doing their best for their children, because let's face it, everybody wants to do the best for their children. Yeah. That's the key message. You want to do the best for your child, and then you should be seeking the best information. And that's what's critical here, that you cannot let yourself by, gossips or fake news. With the COVID, it was difficult, but now we are back on track. And in Europe, it's very difficult to find. We have probably here in Spain, it's only 5% of parents that don't vaccinate. So it's a small amount. It's a different framework.
Yeah, and I think that is an important message. Something that we in History of Vaccines have spread is saying, look, yes, there is a segment of the population that doesn't want to vaccinate. They are skeptical about it for many different reasons, but they are also a tiny segment of the population. We all want to do good for our children, and it's the large majority of parents who do so through vaccination. And then we can reach out to those other parents and have those conversations. And I think your book and the game is a really good way to start those conversations. We also have the book Antibiotics versus Bacteria on antibiotic resistance. What is all that about?
We are finalizing the awareness week here in Europe. It's today, the last day, and we want to spread the message of One Health. If you don't vaccinate, if you misuse antibiotics, you are doing no good to the rest of the world. It's human health for its animal health, and it's environmental care as well. So it's all connected. In this globalized world, René, we cannot let people take the wrong decisions. We need to do what's best for next generations, and we need to preserve the antibiotics we have. In Europe, we have more or less the same amount of deaths per year. So that means 35,000 a year. Wow. There are, regrettable deaths because of resistant bacteria. Those people were hospitalized for a cesarean section or a trauma procedure, and they end up spending a lot of time in the hospital and eventually died. It's horrible. We cannot put at risk what we have reached through science and medicine. And we definitely need to raise awareness in general public. I don't need to convince my colleagues in pharmacy, In Europe, you cannot get any antibiotic without a prescription. That's impossible. You can try and go to a pharmacy, and it's impossible to get an antibiotic without prescription. So that's not the problem. The problem is that people keep them. They get prescriptions for free because they are covered by insurance. They kept them. They have them at home. They don't do the disposal in the right way. And also they take it with, how do you call that? When you have a sore throat and you go directly to
viral,
antibiotics.
Yeah. And it's the same issue here in the US, where people go into the urgent care or their physician and they have a viral infection, they test positive for flu or COVID, and they ask and they demand the antibiotic. Yeah.
They still want the antibiotic. And, it's the way we educate next generation, the way we educate children to preserve all these, because this is our artillery. In the book, we make the resemblance between, Star Wars and the Resistance, and here Resistance are the bad guys. So really, you cannot go the dark side. You need to be aware that antibiotics need to be used in the correct way. And those antibiotics by WHO that are restricted should be restricted and not be used for whatever purpose.
And finally, you told me as we were preparing for the interview, you told me that you received an award for your work.
Yes, we received an award. It was the Sustainable Development Goals from the Council of Official College of Pharmacists here in Spain. And it was an honor because publishing books, outreach science books, and the exhibition or even the play cards are linked to the goals 3 and 5, 3 for health and 5 for education. So those 2030 goals, that agenda that is very far away, we seem it's very far away, but still we need to go little by little, step by step. And this is a little book, but it could be something big, especially for those children that have access to this type of information at schools. We want it to be accessible at schools, at hospitals, clinics, universities, and all that is what makes it very enjoyable, but for everybody.
Great. Thank you so much, Raquel Carnero. She is a pharmacist in Spain, working on many issues around health, pharmaceuticals, etc. I highly recommend the books once again in English, Vaccinating 2 Centuries and Counting. In Spanish is Vacunando 2 años y sumando. The other book is Antibiotics versus Bacteria from Resistance to Counterattack. You can find them wherever you find books.
Yeah, they're available on Amazon. We hope to get it translated into English as well. We want to reach broader audience. So we are looking for,
the book from Marcos, the first one, The Pharmaceutical Epic, also is available in English. That's also a really good book for younger age groups to read and learn about the development of pharmaceuticals, the development of medicine throughout the very beginning to now. So
with a little taste of humor, always.
Yes, that really
Ansola.
That makes those lessons be good. So thank you so much, Raquel, for being on with us today. Thank you, everybody, for tuning in to another public health chat from the College of Physicians of Philadelphia. As always, I invite you to go to collegeofphysicians.org/events for the events happening at the college right downtown in Philadelphia, and now online into the rest of the world. And all the way from Spain, Raquel Carnero has joined us to talk about the books and the game on promoting the science and history of vaccination and other pharmaceutical products. Thank you so much, Raquel. Have a great rest of your day.
Thank you, Ray. Bye-bye.